Welcome to NCLEX over NCLEX. This video is about the fundamentals of nursing practice questions. Don't forget to pause for more time if you need to. Question number 1. A male client with venous incompetence stands up and his blood pressure subsequently drops. Which finding should the nurse identify as a compensatory response? A. Bradycardia. B. Increase in pulse rate. C. Peripheral vasodilation. D. Increase in cardiac output. Answer. B. Rationale. When postural hypotension occurs, the body attempts to restore arterial pressure by stimulating the baroreceptors to increase the heart rate. B. Not decrease it. A. Peripheral vasoconstriction, not dilation. C. Of the veins and arterioles occurs with venous incompetence through the baroreceptor reflex. A decrease in cardiac output, not an increase. D. Occurs when orthostatic hypotension occurs. Question number 2. In evaluating client care, which action should the nurse take first? A. Determine if the expected outcomes of care were achieved. B. Review the rationales used as the basis of nursing actions. C. Document the care plan goals that were successfully met. D. Prioritize interventions to be added to the client's plan of care. Answer. A. Rationale. In evaluating care, the nurse should first determine if the expected outcomes of the plan of care were achieved. Question number 3. When caring for an immobile client, what nursing diagnosis has the highest priority? A. Risk for fluid volume deficit. B. Impaired gas exchange. C. Risk for impaired skin integrity. D. Altered tissue perfusion. Answer. B. Rationale. The ABCs of caring for clients are airway, breathing, and circulation. Impaired gas exchange, B, implies that the client is having trouble with breathing, which has the highest priority of the nursing diagnoses listed. Though an immobilized client presents a multitude of nursing care challenges, A, C, and D do not have the priority of B. Question number 4. What action is most important for the nurse to implement when placing a client in the SIMS position? A. Raise the bed to a waist-high working level. B. Elevate the head of the bed 45 degrees. C. Place a pillow behind the client's back. D. Bring the client to one edge of the bed. Answer. A. Rationale. A waist-high bed height, A, is a comfortable and safe working height to maintain the nurse's proper body mechanics and prevent back injury. The head should be flat for a SIMS side lying position, not raised. B. C. Is implemented after the client is positioned laterally. D. Brings the client closer to the nurse when being turned. Question number 5. The nurse is preparing to irrigate a client's indwelling urinary catheter using an open technique. What action should the nurse take after applying gloves? A. Empty the client's urinary drainage bag. B. Draw up the irrigating solution into the syringe. C. Secure the client's catheter to the drainage tubing. D. Use aseptic technique to instill the irrigating solution. Answer. B. Rationale. To irrigate an indwelling urinary catheter, the nurse should first apply gloves, then draw up the irrigating solution into the syringe. B. The syringe is then attached to the catheter and the fluid instilled, using aseptic technique. D. Once the irrigating solution is instilled, the client's catheter should be secured to the drainage tubing. C. The urinary drainage bag can be emptied, A, whenever intake and output measurement is indicated, and the instilled irrigating fluid can be subtracted from the output at that time. While the nurse is administering a bolus feeding to a client via nasogastric tube, the client begins to vomit. What action should the nurse implement first? A. Discontinue the administration of the bolus feeding. B. Auscultate the client's breath sounds bilaterally. C. Elevate the head of the bed to a high Fowler's position. D. Administer a PRN dose of a prescribed antiemetic. Answer. A. Rationale. When a client receiving a tube feeding begins to vomit, the nurse should first stop the feeding, A, to prevent further vomiting. C. Should then be implemented to reduce the risk of aspiration. After that, B and D can be implemented as indicated. Last question. Which technique is most important for the nurse to implement when performing a physical assessment? A. A head-to-toe approach. B. The medical systems model. C. A consistent, systematic approach. D. An approach related to a nursing model. Answer. C. Rationale. The most important factor in performing a physical assessment is following a consistent and systematic technique. C. Each time an assessment is performed to minimize variation in sequence, which may increase the likelihood of omitting a step or exam of an isolated area. The method of completing a physical assessment, A, B, and D, may be at the discretion of the examiner, but a consistent sequence by the examiner provides a reliable method to ensure thorough review of the client's history, complaints, or body systems. Thank you so much for watching. There will be more questions about fundamentals of nursing coming up soon. Let me know in the comments below what questions from your classes you prefer me to upload. Don't forget to subscribe, hit the like button or comment down below.